Hi guys and girls, so as promised, we'll be talking about the radiology specialty training, and to enlighten us about this highly competitive specialty, we've got Dr. Yogeshwar Gohil, who's a specialty trainee in radiology. So Yogi, thank you so much for joining us, buddy. And yeah, the floor is yours. Please tell the audience who you are, what do you do, and why radiology.
Hi, thanks for having me on your program, actually. We've been talking about this for some time, but it's nice to finally be able to do this. So, um, I guess a little bit about me. I guess you've given a great introduction. I'm currently radiology ST2 in the West Midlands. Uh, the From the perspective of what led me into getting into radiology, I actually think back to just a year before the application, and I was still very, very keen on wanting to do emergency medicine. I'd actually sat one of the MRChem exams, and nothing could have changed my mind. And all of a sudden, a couple of personal things, you start thinking a little bit about work-life balance and radiology. All I did was attend one taste a week in interventional radiology, and that was it. My mind was made. At that point, I decided it was interventional radiology and nothing else. But actually, at this point, when I was doing the taster, it was only 3 months before the application deadline. And I remember thinking to myself, how am I going to be able to get into radiology training this year? That was a big question on the forefront of my mind. And I mean, the through having some good mentors, I was able to get ideas from, and from I think it was 4 months actually, from being able to make a really early organized start into getting my portfolio together, and just making sure that the whole year, which is a bit of a marathon from when I guess the idea is born in your mind to application closure, to then the MSRA, to then the interview, to then actually getting your outcome. All of that is a very long process. And I mean, we'll talk about all of that today, but um, I I think the only reason I was able to get in that year, even though I changed my mind to it so quickly, was because I got some really, really good advice, and it would be my pleasure to share that today, really. Yeah.
Brilliant. So Yogi, so you said like when you were initially not sure about radiology and you change your mind somewhere down the line, right? So, did you have to put in extra effort in order to be ready for the specialty application? And if yes, how did you manage that?
Oh, yeah, absolutely. So, um, when I initially exited med school, I thought I wanted to do emergency medicine. So even the foundation jobs that I had picked were varied, a bit of pediatrics, GP, um, surgery, general medicine, a bit of everything, you see. Um, and you'll know this yourself, but for ED, the kinds of things that you need are very, very different to what you need for radiology, from a recruitment perspective. Um, So my portfolio was pretty much just I had a couple of audits, none of them were radiology specific. I had some teaching, none of it met the criteria for radiology at that time. The radiology application. So my portfolio was not really ready for radiology at all, if I'm honest with you. Um, the only thing that I had that maybe would have helped was, one award in med school and a further one when I was a foundation trainee, and maybe that's the only thing that was transferable. But neither of those things I did specifically for emergency medicine. So I had to do a lot of kind of hard work. And the good thing for me was this happened at the end of F2. So I was an F3, and the job that I did at that time, I managed to ask if I could do it at 80%. So it gave me a bit of, a bit more free time, because it was, it was in emergency medicine, right, at that time. So with the long hours and the rota you have at that time, having a bit of time to yourself, 3 days a week to yourself, actually, it goes like this. The 2 days a week, that everyone gets, they go very quickly. So I thought I need one day where I can just work on the things that I need to get done. So, to answer that second part of the question, you said, what do you actually do? I made a very clear plan from the very outset of what do I need to have the best chance by November of getting a seat this year. So I've actually looked at the document. It's the 2023 ST1 self-assessment document, and I mean there'll be one that's more up to date, which obviously everyone who's watching can look at. but I combed through it many, many times. You know, I remember one week I was sat down and I looked through it on the Monday and I thought, what do I have in my personal portfolio, my CV, that could give me credit for this? And the very, to give you an example, the very first part was taster weeks, okay, or any kind of meaningful exposure to radiology so that you can show you actually know what a career in radiology involves. And all I had was one taster week, and I thought, surely it's not going to be that hard to organize another taster week. You know, that's what I thought, at least at that stage. I must have emailed 20 consultants at the nearby trusts before one of them responded and said, yes, we can have you. And even then, when he did respond, he said, the only way we can have you is if we can organize an honorary contract. So that was another 7 weeks delay then. So, in a nutshell, what I'm trying to say is, if you don't start early thinking about how you're going to get credit, it's very, very tough to be ready for that November deadline. So I combed through that document, like I said, many, many times, and I thought, what do I have and what do I need? And in a way, there's three categories, right? Above all else. Number one is things that you have. You have those. Either you need the evidence for those things, which you might already have, or you need to email a consultant and say, I'm sorry, I don't really have proof that I attended a taster week with you this week. Can you please send me something? It needs a consultant radiologist signature. Done. I did that. Okay, that week. The second category is things that you need that are feasible but by the application deadline. Okay, those are the things where you should focus on. But I'll just touch on that third thing that I was talking about. The third thing is things that will get you good credit but might not be feasible for this year's application cycle. Okay, now if you're approaching it at this time of the year, it's September, you've got 2 months left before November deadline, and like they say, everything has to be done by that deadline. In 2 months, you can't get everything done. What you can do is start to plant the seeds so that if this year is not your year, at least next year you're ready. Okay. So, for example, the teaching, for me, I had to get maximum points. I had to do 3 months of radiology teaching. I didn't have that amount of time prior to the application deadline, so I couldn't do that. But I'd started something that I knew I could have done over, from say October to December, and that way it'd be over 3 months, and I could use it for next year's application. But there are some things I knew I could do. For example, I could have done a train the trainers course. Okay, it's a 2-day course, and you can do it on a weekend. You can do it. You can get study leave for it, however you want to do it. So I had those three categories, and my main focus was, what do I have that I can get the evidence for if I don't already have it, that I've already done? What things are feasible by the deadline? So there was a lot of thinking, some things a week or two after I'd looked through that document, I thought, oh, I got this award in medical school. I didn't really think anything of it at the time. It was a bursary, very small bursary, but it was a bursary. And I thought, does that count as an award? Technically, it was provided by the Society for Endocrinology, which is based in Europe. So technically, it was international. And there will be people who are applying who have those things who don't realize they have these things. So in a nutshell, I think it's very important to kind of retrospectively look at your career so far. Think of what things maybe you have done that could help your portfolio. And most importantly, you want to make sure that it does meet their criteria. I got marked down for one or two things. They said, unfortunately, this doesn't meet the criteria. But it just adjusts your expectations. It's okay if you think it's fair and correct. Ultimately, they are the ones who will assess it and come to the final conclusion. But you give it your best shot, right? You think, okay, I think this is legitimate. I think they will accept it. Let's see what happens. So by doing that, I went from a portfolio score of, I think it was only about 12 to somewhere in the high 20s. So almost doubling, right? And even then I remember thinking, portfolio score is only about 27, 28. Will I get in this year? And the guidance that I had from my mentor, who's now an ST3 in radiology, he said, you have to assume that you're going to get in, and you have to put in the effort from the very beginning on the assumption you will. So between now and November, you just focus on your portfolio. Nothing else matters, okay? Because if you want it that much, every free moment goes into getting an extra point, okay? And then from November onwards, you just focus on the MSRA. And I remember I took annual leave for most of the month of December. I was actually moving house at that time as well. So I needed the leave. So it was a very kind of busy time. And I'm not sure if you remember, brought you on that day of Christmas Day, even while you were working in ED, maybe.
Yes,
Yeah,
yes.
yeah. So it was a very busy time. I just moved house at that stage, um,
Okay.
but you spend all that time preparing for the MSRA then, and MSRA we'll talk about in a moment. But kind of big picture, he just said focus on your portfolio until November, and then just focus on the MSRA, just so that you can kind of make it very clear to your brain, this is your sole focus. You just have to get this right. Okay. And then, as and when the interview came up, once the MSRA is passed, you start focusing on interview. But we'll get on to that in a little while, of course. But there was a lot of change required for the portfolio, um, and there were lots of ways I went through it, which we'll talk about. But you have to kind of know what work you need to do, how you're going to get credit, or according to their scoring sheet before you put in the effort. Otherwise, you're just wasting your time, right? And our time is limited, especially when recruitment cycle is just around the corner, and ratios are ever rising, right? So you have to know where to put your energy in and just create a very solid plan for it.
Brilliant. So I just love the concept, Yogi, when you said, there are few things that you can have, and there are few things there's no point rushing onto it because it's too late, and then think about next year. I think that's a very, very good take home point to all the guys and girls, because yeah, you can't always have the best things and then apply for the specialty. Sometimes you just have to, just as you say, assume that you are going to get in and just start planning for it. On that note, Yogi, MSRA has gone absolutely nuts, man, because I would say when I applied for specialty training 3 years ago, MSRA was just introduced as a short tool for
Mm.
emergency medicine that year. And I would say, luckily, unluckily, that was one of the prime reasons I ended up taking internal medicine training, because I scored about 460 on the MSRA, and the take up, I think, cutoff was about 485, 490, something like that. But for radiology, I think it's on another level, isn't it? So you're going from Mount Kilimanjaro to Mount Everest. That sort of difference is what I felt. So tell us, how did you manage to score the brilliant numbers which you did?
So um, for the MSRA, I asked a lot of people who had managed to get into training schemes for their advice. There was one specific lecture that I watched, which I can send to you a link of as well if you want to put it um, in the notes at the bottom of this video. But effectively, all you need is good advice from people who have got good scores, and you need to relate that to how you learn. Okay, so the video that I watched, it was from an ophthalmology trainee who managed to get a number in London. So not only did she get one of the highest scoring, um, one of the most competitive training numbers, but she got a spot in London, which is even more competitive. So immediately that made me think, I need to pay attention to this lady. And she broke it down very simply, and she said that um, for the clinical part of it, there's two parts, as clinical problem solving and professional dilemmas. We'll talk about each of those in turn. So clinical problem solving, that relies on, for the main part, pattern recognition. Now, um, it whilst you can go through, past medicine question bank once, you can go through past test once. What doesn't really help is just going through it. What helps is making sure that the things that you're getting wrong, you understand and learn, so that next time you won't make that same mistake. Because sadly, the thing is, when it's competitive, when anything is competitive, you have to do what everyone else is doing as the bare minimum. Okay, and what you have to do then afterwards to boost your score is something that maybe they don't have time to do, or something that is a bit tough, or there's a barrier to it in people's mind, or physically there's a barrier because of lack of time. However, so some of my friends who've got into maybe ophthalmology or radiology for ST1 intake this year, I know they started preparing early, and that's what I did. I around late October, I'd started going through the past medicine question bank. And my strategy was actually anything that I wasn't getting right, anything that I didn't understand, I would go away and read on, and I'd create a flashcard. And in fairness, I didn't get a chance to go through the past medicine question bank more than once. I did it just once only. But I'm confident, because I made those flashcards and I was revising them up until my exam, which was in January. I'm confident that everything that I got wrong, because I'd made a flashcard for it, I had managed to learn it for the time the exam rolled around. So when it mattered, that knowledge was in my head. And the good thing is, because it's because it is multiple choice, even if you don't know, you can still get some credit. But I remember, even though I'd covered all of the specialties, the ones that you don't see in foundation being your harder ones, like ophthalmology, I struggled with a little bit. Obs and gynae you don't see in foundation unless you specifically do a block in it. I had to put in more effort. But the thing that saved me was knowing it's multiple choice. So you make an educated guess when you're not sure. But what's really important is not to do the bare minimum, which everyone else will do, which is consistently over a long period of time, 2 or 3 months, doing all of the questions on past medicine, which kind of, from what I've heard anecdotally, is the norm. You have to make sure things you're not understanding or you're getting wrong. You don't just look at it and think, oh yeah, I'll definitely remember that next time. You have to internalize it somehow. So that's from the kind of clinical parts of things. And I mean, again, I think asking around people who got good scores, whether they used one question bank, some people are now using two, which I think I would have really struggled with when I was applying because of how little time I had. But if it means people get better scores, I think that's the way you have to do it. And the second thing is professional dilemmas, which is probably where having a bit more discussion is helpful, because it's a little bit more abstract, isn't it? You must remember the kinds of questions that you got as well for the professional dilemmas part. There's no textbook that teaches you these things, sadly. So there's a few different things for the professional dilemmas part. I did use the past medicine questions. I did look at the guidance tools that were on the UK Health Education England website, and there were some old question papers from the foundation program, which I had to sit the situational judgment test for the foundation program, which is a very similar test. So I used those questions once again, and I remember reading them in my final year and thinking, if there was a consultant who was drunk who came to work, I'm not sure what I would do, but I'd probably, on paper, what you would do is, you'd have to escalate maybe to a nearby consultant for safety. You'd have to tell the clinical director. But there's almost a bit of a, because real life scenarios are never black and white, there's always a bit of gray there. You have a working relationship with the consultant. You have to make sure that you go about it in a safe, pragmatic, respectful way. You would obviously keep patient safety at the forefront, but you have to make sure you're following those guidelines that everyone's bound by, like good medical practice and ethical guidance by the GMC and confidentiality and everything. So there's a lot more learning for the professional dilemmas part than you might think. And my first step was to practice a few questions from past medicine and figure out where my weak spots were. Themes that kept coming up, like patient safety is always at the top, understandably so. I kind of made a cheat sheet, a mental cheat sheet to remember. I wrote it down and I thought, this is my revision material for the exam. And whatever concept kept coming up repeatedly, it just became more and more important for me to keep it on my document. And things that I wasn't understanding, I would then go through, GMC guidelines to understand, why is this the case? So, the scenario that I would dread if I was in GP, for example, would be there's a patient who has HIV. He's refusing to have antiretroviral therapy, but his wife is also registered at your practice, and this is, I hear this kind of question comes up commonly at interviews, even because it allows you to discuss lots of ethics, but it's inherently a very challenging scenario. And there's no wrong answer as long as you're doing the safe thing for the patient and not harming the wife, right? But this exam, there's only two ways to answer questions. Either it's you pick 3 out of 8 answers, or you have to rank. Now, in real life, you would think, oh, but I wouldn't just do that and that and that, those 3 things. I would do these 5 things because I think that's what's safe. But because the exam is a bit of a, they have to create a way to examine people on this. It's a little bit, I dare say it's a little bit artificial, and that's why you have to make sure that as a minimum, you're doing what is safely expected of you, which is what's published in the guidance, good medical practice and whatnot. So you have to sit down for a long period of time with these resources and think, I got 5 out of 20 for this question, where are the things where I could maybe improve my mark from 5 to 15? And the most helpful thing for me was, once you have a bit of knowledge, for the part of the question where you have to rank 5 things, if I just put my hand for it, um, the best way to get marks for this, because each of these answers, if it's correct, it's worth 4 marks. That's how you get 20. So if this one's in the correct position, the top one is at the top, you get 4 marks for it. If it's 1 step out of place, it's 3 marks. If it's 2 steps out of place, it's 2 marks, 1 mark, and 0 marks if it's in the wrong spot. The strategy that I was told was, pick your top answer and your bottom answer right at the beginning. And the reason you do that is you're more likely to get 4 and 4 marks. Okay. And once you've got those 4 and 4 marks, even if these 3 in the middle are incorrect, the worst that will happen is it's 2 out or it's 2 out. Okay. Because you've already picked the ones that are most convincing and least convincing. So some of it is strategy, some of it is knowing the material, but overall, I think the thing that it comes down to above all else is you have to put in a lot of time. And I felt a bit sad that I couldn't get, I think I got maybe study leave for the actual exam day. I didn't get any study leave for the MSRA because, let's face it, there'd be no doctors at work if everyone took study leave for the MSRA. But I think using your annual leave and planning your time wisely so you can finish a question bank and think about strategy for the professional dilemmas, and make sure you're going through the resources, for each of those, is very important. And one thing I wanted to mention, as well as that UK Foundation Programme Situational Judgment Test paper, I think one other resource which is very good is the GMC's interactive cases. There'll be The GMC has cases that basically they illustrate good medical practice. Now, I had to do them at medical school as part of a compulsory module, but I actually went through them again for the exam. And the thing that's very good about them is, whilst they're not produced by Oriel or the recruitment office, definitely they're not. They're produced by GMC. They're very complex ethical scenarios where there's a bit of interactive element to it, where you say, in this scenario, I have 3 options, I would do this. And it gives you feedback on what's correct and what's not. So it's as close as you can get to having someone teach you the content without actually paying someone to physically sit with you and teach you the content. And they link to their own guidance, of course, the good medical practice guidance and confidentiality and consent and all of this. So there's a lot of resources, but if you don't plan early, sit down early and think, okay, I've got this much time, I'm going to take this much annual leave, my exam's going to be on this day, then it's tough because there's a lot to cover. It's a very intense year getting into training. But as long as those things are done, then, and you work consistently and you're doing what everyone else is doing as a minimum, that way you can get a good score for the MSRA. It is my view on it.
Brilliant. I think you've narrated among the best strategies to solve the SJTs. So thank you for sharing that, Yogi. I really appreciate, you spilling the beans so that, more and more of our colleagues who are planning to give this exam. I would say I struggled a lot with SJT because I've not studied in the UK system. So coming from a different educational system, it was really difficult. Had I known that, if we could arrange, now I'll remember this technique, the top most and the bottom one. So I think that's brilliant. Okay, Yogi. So after you smashed the MSRA, you went for the interviews. Tell us a bit more about the interviews. Was it very intimidating? How did you prepare? What were your resources where you utilized to prepare for it essentially?
I mean, I was terrified once I found out I had an interview, because in my mind I thought, I've gotten this far, I really don't want to fail now. Yeah, and even I've never actually been sweaty or stressed for an interview, even my medical school interviews, I remember. But for this interview, which was, from home, it wasn't in person. I remember I had sweat patches. That's how, how worried I was about the outcome. I was just, it was, I think February or March. The temperature outside was warm. Some sunlight was coming in through the window. And I just remember thinking, I really need a fan, but the interview is going to start any moment. But as regards interview preparation, I mean, the people who have the mindset that I spoke about in the beginning, that I'm getting in this year, the moment they've sat the MSRA, they're no longer worried about the MSRA. They're not thinking, I'm not sure how I did on that question. I'm not sure how I did on that question. They're already thinking, I'm going to start preparing for the interview now. So the people that I know who performed well, as soon as the MSRA was out of the way, they'd already started preparing for the interview. I actually, myself, I didn't start that soon after the MSRA. I had had a very intense sort of October to September to December, and I just moved house, so I had lots of other things that were going through my mind that I had to do. But I thought, let me try and get all of those things done by the end of January, so that beginning of February, I can just focus entirely on this. So, in a nutshell, that's what I did. When I started, I I did actually um, I did actually join a paid interview course, which I think again a lot more people are doing. And in my mind, the thinking was, if I don't do this, how will I be disadvantaged? There is a free UKRST radiology interview course, not course, sorry. They do practice interviews, and I myself was a trainee. Actually, was the interviewer on it last year, but sadly I missed the slots. They released the slots and they were all gone because it's so competitive. People wanted them. So I remember I paid. I can't remember exactly how much it was, but I remember thinking this is a lot of money for an interview, and the only slot that was left was, I think, the very next day after I decided I'm going to start preparing for the interview. So I had done no preparation on it at this stage, and it was Radcast, the people who held the interview, and my mentor, the person who helped me with advice on how to get in, told me that he also did the interview course. So I thought I'll do it. My goodness, the feedback I got from the person who held the interview. At the end of the interview, he said to me, he said, "Yogi, do you want the honest answer, or do you want me to just soften it up for you?" And I thought, well, this isn't good. Okay. And I don't know why I wanted this torture, but I said to him, just tell me the truth. Okay. And he said to me, if you don't put in the hard work now, you may as well not even turn up for the interview. And it was brutal. It was brutally cold and it was brutally honest. And he just said, there's no um, there's no thread to your answer. There's a lot of fluff. There's a lot of wool. You haven't done your reading, and it shows, because I asked you a question about one thing and you're suddenly now answering a different question. And I mean, I don't know if the people who are watching will find this as a funny story, or maybe a little bit terrifying, but the gist of it was I knew that interviews wasn't my strong point, because um, kind of behaving in that really formal way is not something that's natural to me. You see me at work, I'm much more of an informal person. When you have to be formal with a patient, that's a different story because that's your professional task, but you do that every single day. But preparing for an interview felt like a big kind of mammoth task to me. So actually, I was very worried at this stage, and I thought, how do I prepare? So my strategy preparing for the interview, bearing in mind I'd started late, was the same strategy I used for medical school interviews. So for this, again, I'm going to use my fingers for this because I haven't got slides prepared. But I think your interview performance is limited by two things. The first one is the content that you know, okay, the actual knowledge that you have, and secondly is how you deliver it. Now, I think it's easy to kind of think I'm going to start working on my delivery from the very early stages and start doing practice questions. I would actually advise that you hold off on that and you start off by learning about the content first, because otherwise, your delivery will be limited by that. If you don't know what you're talking about, all you can talk about is some woolly, fluffy stuff, which isn't really going to get you the credit. So the first 2-3 weeks, I learned just about things like, for radiology, the kinds of things that can come up in the interview are, there's a long list of them. And if I were to give you just a few, for example, it will make you realize just how much breadth there is to the things that they can include. So there's the training scheme, how does training actually work? What are the exams? What models of training are there? So there's the academy model, there's the traditional model, and that's just about the training scheme. And then there's things about the specialty, such as what is the role of AI in radiology? What's the role of radiomics? So that's kind of focus to the specialty itself, but there's other things they can ask you about in the specialty, like for example, where do you see the future of radiology in 10 years, 50 years? So again, that's just for radiology. Some of the things that I remember preparing for also were the history of radiology. So not just looking forwards, looking to the past, and how fast it's come in just the last 70 years, where, approximately 70 years ago, there was no such thing as CT. And there would have been some radiologists who didn't actually learn how to interpret CT whilst they were in formal training. as it would have come afterwards. So radiology has been a rapidly progressive specialty since the outset. And if you can't speak that language with them, of PACS, picture archiving and communication software, and RIS, radiological information software, but like I said, what the bare minimum that people will be doing is they'll know these words. So if you don't know these words, immediately when they're ranking you, you might rank a little bit lower. No one wants that. So you have to do the bare minimum that everyone else is doing. So there's a lot to learn before you start preparing for kind of the answering questions. And any kind of clue that they give you as to how they're going to ask you questions, you should focus on that. So I think I could talk about this with you. It's not really kind of private knowledge. I can't disclose obviously what they asked me in my interview, but they did say one stage will be kind of your willingness to do radiology. And I think there was 3 or 4 questions there. And the other station was a prioritization station. Now, I was expecting, 4 different CT requests, and me as the radiologist will have to decide which one comes first, then which one, then which one, then which one. Okay, and I remember they snuck in a few MRI requests in there, and I remember thinking, oh, this has really caught me off guard. But the good thing is that I'd practiced how to answer each of those questions. So I practiced prioritization with one of my colleagues who was also applying for radiology that year. And for the other part, the part where it's like a panel interview, they ask you a few questions. I prepared a few answers to common questions like why radiology, and what do you see as the future of radiology? What's the role of AI in radiology? All of these different things. So I was ready for the first part, and I kind of prepared myself for the prioritization station. And I didn't start working on the kind of answers that I would give for that until I was closer to having more knowledge. So there's a bit of strategy required for the interview as well. A bit of planning. If you've got 3 weeks before the interview, you spend maybe a week, week and a half, just intensely learning as much as you can about radiology history, radiology future, radiological terms, and then you start practicing. And best to practice with someone else, someone who ideally is kind of a different person to you, like not someone who's your immediate best friend. And the reason I'd say that is someone who's a little bit different to you will have learned different things that you won't know, and you can actually share more knowledge with each other. So I remember my friend who I did the radiology training, radiology interview preparation with, who's now actually a radiology trainee in London. She actually, whilst we went to the same medical school, we'd actually never met beforehand. And there's all sorts of things that she had done in her portfolio, which I had no knowledge of beforehand. So we were able to learn from each other. So I think it's easy to find a friend to do practice with. And if you can't find anyone else, then fine. But it's better to speak with someone who has a different knowledge base to you, so that you will learn more from them, and symbiotically they will learn more from you, and you'll have a better performance then. But the interview was terrifying. Yeah, and they do ask you to show your ID and everything, which I didn't actually have on the day. It was upstairs, and I had to run around. I've already told you how stressed I was on that day. I think I slipped on the stairs. I was just very, very frazzled. But I remember 30 seconds into the interview, I thought, okay, you've got to calm down, and you just have to give it your best because you've put in the preparation for this. Yeah, as it is with any kind of performance, you have to just perform to the best of your ability. And unfortunately, because my MSRA score, whilst it was good enough to get the interview, my portfolio score had only, because it was only in the high 20s, it was my interview performance that actually took me over into getting a number then. So the reason I said at the beginning, you have to focus on each part at a time, is because what's the phrase? Journey of 1,000 steps begins with a single step, right? You have to take each step at a time. And if you focus on the interview from the beginning, you don't even know that you're at the interview stage yet. And there's so much to learn, which you might forget by that stage. You just focus on what is in front of you at the time and take it one step at a time and give it your full focus. I think that's, in a nutshell, I think that's the best method to kind of get to success. Yeah, but I don't miss that interview at all.
Thanks, Yogi. That was so inspiring, because I think it resonates and reflects for most of the people when they have their interview, something or the other. They would have some form of challenges which no one expects, but they do turn up. And I think it's the way you play with all those challenges and still deliver the best out of you. So well done, Yogi. Really proud of you, buddy. So moving on. So that part's done. Now let's talk a bit about radiology training perspective. As you rightly talked, how long is the training for? What are the exams you need to give? Just to give a brief overview to the guys and
Yeah,
girls.
of course. So, um, in a nutshell, radiology training is, as a standard, it's a 5-year program. They have recently been offering 6-year run-through programs where you'll subspecialize as a diagnostic radiologist, which everyone who does radiology is expected to be, and also an interventional radiologist. That is a 6-year course rather than the 5-year traditional radiology training scheme. Let's break those 5 years down into kind of what happens from beginning to end. And I'll talk about how interventional radiology is a little bit different. So it's a 5-year training scheme. The first 3 years are actually spent focusing on general radiology. So in ST1, you sit the first 2 radiology exams, the FRCR exams. There's a physics paper and an anatomy paper. And you do actually sit it quite early, in March. So West Midlands, I started in September. So that was only about 7 months into training that we had to sit that paper. And most people do pass it on the first attempt, but postgraduate exams, especially fellowship postgraduate exams, they're really, really tough. And even though I remember I was told ST1 is a very kind of relaxed year, you're supernumerary, you have a lot of teaching, I maybe underestimated how much of my own kind of bookwork I'd need to do. So ST1, I remember spending a lot of it actually just studying, having to relearn anatomy that maybe when I learned in medical school, either it wasn't memorable or I didn't learn it in that level of detail. Like neuroanatomy, I learned it in a good amount of detail for medical school, but I remember forgetting most of the stuff that I wasn't using day to day. Whereas for the FRCR exams, I had to learn it again, and it's relevant then for the next few exams. So you have the exams in March of ST1, and after that's complete from ST2, you will be on the on-call rota. So I can only think of a handful of training schemes where you don't start on calls until later in the training scheme. But when you know you're going to be on call, saying there's no PE here, or there's no renal stone here, or there's no hemorrhage here, your focus then becomes that. But what that means is by the end of ST1, you've got a very good grasp of basic anatomy, you've got a very good grasp of the physics, so you're happy to say we can radiate this patient or this radiation exposure is not justified. And then finally, you're ready for on calls. Okay, so when ST2 begins, in theory, you're ready to be on call, right? And because of that, you can now start focusing on general radiology. General radiology meaning having a basic understanding of thoracic radiology, cardiovascular radiology. I remember it almost like my three years of clinical medicine at medical school. So we rotated through urology, abdomen, GI surgery, plastics block, dermatology block. So it's almost like that, but through ST2 and 3, you're going through all of the specialties that are relevant to radiology, breast from mammography, for example, and neuroradiology, head and neck radiology, all of these as blocks, whilst also preparing for your next exam, which is the FRCR 2A exam. So that's the kind of middle exam after you've sat your ST1 exams. And you tend to sit that right at the beginning of ST4. So as soon as kind of ST4 starts, you've gone through all of the blocks. Then at the beginning of ST3, you need to have done radiology for 2 years when you sit that exam. So you sit it at the beginning of ST3. The reason they have it at the beginning of ST3 is because officially you're not supposed to progress through training it from ST3 into ST4 until you sat that exam. It's quite a big exam, and the idea is once you've covered that exam, you have a very good general knowledge of all radiological disciplines, cardiovascular, thoracic, everything. And then you've just got your final FRCR exam to do, which in theory you could do in your final year if you wanted to, but even on the RCO website, it says ST1 to 3 is core radiology. You learn your general radiology there. You pass your first few exams and you learn physics, anatomy, and pathology. And what that means is once you've done that, you can start ST4 and 5, which is subspecialty. So anyone who does an on-call CT reporting session, there's a consultant radiologist who's on call over this weekend, say, and he sees an abdomen pelvis scan and he suspects that there might be an ovarian malignancy. He obviously won't say, there's a mass there, but I have no idea what it is, because he's generally trained. But the person who wants to be a genitourinary suspect radiologist will then spend their ST4 and 5 years focusing on that so that they can say, well, we saw that on the CT, but we've now done an MRI of the pelvis, and I can give you a radiological diagnosis of what's there, okay? Which maybe not all general radiologists will feel comfortable doing, but that's what you spend your final 2 years on. So in a nutshell, from ST1 to ST5, that's what you cover. First 3 years are core radiology, and your final 2 years are subspecialty into whatever diagnostic field you choose. I did say I'd touch on interventional radiology, and the only difference to that is once you finish your core radiology years, your first 3 years, then you start interventional radiology subspecialty training. And interventional radiology is not 2 years of subspecialty training, it's 3 years. And the reason for it, from what I understand, is it is a procedural specialty. You do need a lot of practice and observation to then be signed off as competent to be able to perform those procedures independently. But I mean, if I can say this, I'm really pleased that I chose a specialty that is run through and has a fairly short training program, 5 years or 6 years, depending on what you want to do. But actually, a lot of people in my training scheme have said even 5 years feels like it's not enough because there's so much to learn. And even the TPDs tell us that. But 5 years is almost a very condensed program. And the one thing that, if you don't mind me saying this, I think you did want to touch on take-home messages in a little while. But one thing would be kind of my advice from being on the training program now, would be not to choose radiology unless you're happy to put in a lot of academic focused hard work, which I think is really necessary for, it's necessary for any field, but the way that radiology is different is it feels like there's a lot more bookwork, and you have to be quite academic and thinking, okay, this radiological sign plus this radiological sign equals this. And by comparison, in emergency medicine, I needed to have very superficial knowledge of a lot of different content to be competent in ED, because I could say, I'm not so sure about that. Please speak with, let's refer the patient to ENT, for example. Whereas in radiology, you can't ignore something if it's there. And obviously we look at everything that's on the scan, right? So if you see something, then you have to go into detail on it. And every single thing provides a clue. If there's a history of a burr hole, for example, on a CT head, you might think maybe this patient had an aneurysm in the past, right? And because they've had an aneurysm, they previously had a subarachnoid hemorrhage, perhaps. Otherwise, why would they have a burr hole for decompression? So there's lots of clues, and it's a very academic discipline in that way. And I kind of enjoy that now, but it's not something that I knew about before I started radiology, or I'd appreciated. And even in one of my interviews, they did ask, something about what radiology is like as a discipline. I answered it at that time, but I realize now how different my answer would be now. But 5 years, initial 2 years of initial 3 years of core training, and then 2 years of subspecialty training, or 3 if you want to do interventional radiology. But they're very intense first 3 years where you're learning general medicine all over again, but this time radiologically. Yeah.
Brilliant. Thanks for sharing that, Yogi. That was quite insightful, in-depth, and quite thorough. So, guys and girls, now you know how radiology training works. So, Yogi, what I would, ask you to kindly summarize would be your take-home points for the guys and girls who want to become radiologists and afraid, number one, because the competition. Because each year when you see the competition ratio just going up and up and up. I remember when I applied, it was about 6 or 7 or something. I think this year when they published it was 14, 15, something like that. So, what would your take-home message would be for the guys and girls?
I also remember seeing the ratios being that competitive when I was applying, and it was very disheartening because 2-3 years prior to that, the ratio was, I think, 3 or 4 to 1. I guess, in a nutshell, if it's something that you want to do, you should absolutely go for it, 100%. The important thing is, like I said, is to focus on the things that either you already have and make sure you have the evidence for those. Secondly, would be to focus on the things that you can achieve in the time frame that you have up until the evidence deadline. But to the point of the competition ratios, I would argue that the competition ratios to some extent should be ignored, because whether the ratio is 13 to 1, 20 to 1, or 5 to 1, you don't know what the other, who the other applicants are, what level of experience and knowledge they have. And um, you know, I've done a bit of stoicism reading for philosophy, and it tells you to work on the things that you have power over, as opposed to the ones that you don't have power over. So if I was focused on the competition ratios, I would have thought I shouldn't apply because I'll never get in. But instead, I thought, okay, I'll work on the portfolio because that's all I can do at this stage. Okay, now that I've got the portfolio out of the way and my score has gone up, I'll work on the interview because that's all I can do at this stage. So the competition ratios, I think, with everything that's going on with kind of postgraduate training in the UK, there's a lot of reason to be disheartened. And I think there'll be lots of viewers who are thinking it was easier when he did it, and maybe that's why it's easier for him to say it. But I didn't have high hopes. On paper, I didn't have, no one would have thought I'd have a good chance of getting into training that year. I'd like to think that obviously there was someone up there looking after me who knew that I was driven and allowed me to get in. But kind of how did that actually transpire on planet Earth? It was having a good mentor who said, these are the things that you can control, these are the things that you should focus on. And kind of just taking it one step at a time. Because now that the MSRA is done for every single specialty nearly, how many of those maybe 14 other applicants who are competing with the same spot as you secretly want to do core surgical training? How many of them are just applying for radiology because they're thinking, why not? So you have to kind of take that number with a pinch of salt, I think. And most importantly, I'd say to focus on the things that you do have control over. And, in an absolute summary, very, very, condensed take-home point for people watching would be the things that you can work on are in stepwise order, chronological order, would be number one, your portfolio, making sure that you go through what they're actually after and how you can achieve that in the time frame you have. Number two would be touching on your MSRA preparation. And again, you know how you learn best, but making sure that you consider that you go through at least one question bank, maybe more if that's what others are doing. And then finally, for the interview, to start preparing as soon as possible. And as long as you do those three things, you give yourself the best chance. And who knows, next year it might be a bit tougher, it might be a bit easier. But if you give yourself that best shot of this year is definitely my year, I'm getting in, my view is that it gives you a bit more strength and a bit more motivation to actually put in the effort when you hear all these things in the news and training numbers being reduced and you think, I don't want to do it. If you have that motivation, you'll persist. And persistence ultimately is a key to success. It is what kind of all successful people say. So I think we should use that strategy. So stepwise, it would be the working on the portfolio in the first place, then the MSRA, and then the interview.
Brilliant. Thank you so much, Yogi. That was so insightful. And to be honest, I've done this sort of podcast after a very, very long time. Even I'm feeling so many things that I can learn from you and bring it to my practice. So thank you so much, buddy. Guys and girls, so the time's coming. You need to tighten your belts and just give your best, and hopefully you get into the trainings in your desired specialties. But yeah, thank you so much, Yogi, for all the deep insights and the personal learnings and experiences which you've shared with us. I think it will reach to a lot of people and help a lot of people as well. So thank you so much, buddy.
Thanks, man. Pleasure to hear those really, really positive words for you. Thanks very much. All the best to you guys. Bye-bye.
Thanks.